Hello, my name's Helen Wallace and I'm sister here in the Home from Home unit. In the Home from Home unit, we like to promote active birth as a way of coping with your labour instead of using epidurals and remifentanil. Having said that, we do give pain relief, we give EnterKnox, we use pethidine as well, and very often we use the water for pain relief in labour. So in the Home from Home, it's all about getting your baby into the most natural position to be born easily. And what we would do is encourage you to think about 2.5 extra centimetres of room within your pelvis. So whenever you're standing up straight, I would like you to put your fingers just below your tummy and just round the back between your buttocks on your coccyx and feel how tight that can be. And now I want you to just gently move your feet to the side, bend your knees slightly and tilt forward, and you will feel your pelvis opening up, and that gives you 2.5 extra centimetres of room within your pelvis to allow your baby to move through. Also, this tilting forward sensation also allows the pubic bone to fall forward, and there's free and easy access for your coccyx to move at the back. And so the baby, as it's moving through the pelvis, can push your coccyx out of the way, and it has the optimum amount of room to get through and be born. So what I would like to show you now is some positions using the beanbag. You may not have beanbags at home, but that's okay. I can show you some equipment that you can use in the house later on. But what I want you to do, or would want you to do, is to get down on your knees in front of the beanbags. I want you to have a nice 90-degree position with your legs to your back. Lean across the beanbags and be able to get your head down into them. You've got a nice straight back. You've got a nice 90-degree position with your legs. And this position encourages the baby to tilt forward, pulls the baby's head round into a nice anterior position, but it also encourages the baby to move down into the birth canal. And it's nice and comfortable as well to give your back some rest in the evenings. So you're leaning down across the beanbags, head down, nice straight back, and then you do the pelvic rocking from side to side. And this just encourages the baby's head to tip the muscles of the pelvic floor and help rotate it round into a good position for labour. This is also really good for evening times. If your back has been very sore, it takes the pressure off your back and it gives your partner some access to your back that he could do a wee bit of massage there as well. I'll just show you that position using your own equipment at home on the floor. All you need to do is put a little cushion down on the floor and a chair and a couple of pillows on your chair and lean across your chair. Just remember to have a nice straight back and a good 90-degree position with your legs to your pelvis. And just sitting in front of your favourite tea-brew programme in the evening for about 20 minutes and just do the pelvic rocking exercise, and that just gives you exactly the same effect as if you were using beanbags in the hospital. This is a really good position for exercise at home. It gets you ready for labour, but also whenever you're in labour, it's really good because it's going to take a lot of the pressure off your back, especially if you're feeling a lot of pain in your back. It'll take a lot of pressure off your back during labour and also helps to rotate that baby round into a good position in the birth canal to be born. I'm just going to show you the same position on the bed because we don't use the bed very often in the Home from Home. However, you don't want to be walking around all the time, and at some point you maybe want to rest, and the bed's very good for that. But we don't use it in the regular position. Again, we would use it in an upright position, and I'll just show you how you can do these same exercises using the bed. So here we are, we're on the bed, you're in labour and you're wanting to rest. But you've got something nice and soft underneath your knees because of the mattress. Again, you're leaning across the bed. You've got a nice straight back. You're not just as horizontal as you were on the beanbags, but that doesn't matter. You still have got gravity, taking the baby downwards. You're still leaning forward, tilting the baby round into a good position to get into the birth canal and to come out. And you're also able to lay your head down and rest in between contractions. And it just means that you're not walking about all the time and you're using the equipment that we have here in the Home from Home to the best benefit. So a nice straight back, nice 90-degree angle of the legs and resting your head down. But again, those pelvic rocking exercises are very important and that ensures the baby's head is tilting forwards, hitting the pelvic floor muscles, rotating into a good position, and hopefully, if your baby is lying in a posterior position, helping to rotate it round so that it might come out that wee bit quicker, but certainly it will give you much more ease in your back from the pain that you might be having. I'd also like to show you the Combi Track, which is really just a big gym ball. It's attached to this stand. There's a big pole and a rope that hangs in front of it. Lots of women have used this whenever they've been in labour and they find it very comfortable. And it's just a matter of sitting on the ball. The trick about this is if you have a gym ball at home, you can use this as an exercise at home as well. But be sure that you steady yourself with a dining room chair or something in front of you just to make sure that it doesn't roll away from underneath you. We have a plate under ours so ours doesn't roll away. So what you do is you sit on the ball, you've got legs in a nice wide position, and you lean forward. Now, at home you'll not have a rope to lean forward to, so you lean forward onto your dining room chair. And from this position, you can also do your pelvic rocking. So you've got your legs in a nice straight position, 90-degree angle from your pelvis. You're tilting forward, which allows your coccyx to move at the back and allows the baby to move through. Also allows your symphysis pubis to fall forward at the front and gives plenty of room as well to allow the baby to move through. And then you've got your body in a nice straight line, which is giving you a good gravity and allowing the baby to move downwards. So you lean forward on your ball and you just rock yourself from side to side. So you can do this at home on your gym ball, 20 minutes again in front of the television. And then you can do swinging backwards and forwards motion. So that's a good exercise to do from about 34 weeks onwards, but it's also a very comfortable position for labour. The main tip is not to have your gym ball pumped up too high. You want it nice and soft so that it's comfortable underneath you, gives you plenty of bounce, and allows you to be nice and steady on the ball. And this is one of the things that the ladies use a lot whenever they're in labour because they find it's a very comfortable position to sit on. And also they find that whenever they're having a contraction, what they can do is pull up on the rope, and this straightens their back, it lengthens their back, and especially if they have a lot of pain in their back, this straightening and lengthening helps to relieve the pain in their back. When the contraction's over, they sink back down into the ball and relax. You can have a partner sitting behind you on the little stool, and in those occasions then, you can just lean back and rest against them. Or if you're having a contraction and you're up, they can be giving your back a little bit of massage at the same time. So many of the ladies within the home from home like to use water for pain relief in labour. Some of them like to deliver in the water, and we've actually had about 40% of water births in home from home since we opened. So the bath is in here. It's by no means essential for you to get in the water, but a lot of the ladies do like to try it. We keep the water between 36 and 36.5 degrees for labour itself, and that's important because we don't want you to get overheated. We also would get you to drink a glass of water, at least one every half hour, and that's to keep you hydrated while you're in the water because you do lose a lot of water yourself through heat and steam, and then you get tired and the baby can get overheated. So in the water temperature about 36.5, you're drinking a glass of water about every half hour. And when you're in the bath, it allows you to be very buoyant. Lots of ladies just like to lie in the bath. They like to let themselves float. And when they're in that nice floating position, that means that, again, their coccyx is nice and open, their symphysis pubis is free as well, and it allows the baby to move down through the birth canal. Other ladies like to adopt a hands and knees position in the bath, which is the reason why we would have a kneeler. We would put the kneeler in the bath, they would lean over. We would also put a pillow here for them, and they would kneel in the bath, hold on to the bars and lean over there. And then that gives them a good gravitational position as well, allows the baby to move down. Again, it's tilting them forward, tilting the baby forward, moving the baby into a good position. But at the same time, they've got the nice warm water giving them pain relief. And water actually is pain relief. It's not just for relaxation. You will find that water actually does give you relief of pain whenever you're in the bath. So we would have you in the bath for about 5 hours. So we tend not to let you get in until you're about 5 centimetres dilated. Once you're 5 centimetres dilated, having good contractions, about 3 within a 10-minute period, we would let you get into the water. If we found that your labour was slowing down at any stage throughout being in the water, we would get you out for a little while, get you moving, get you on the bed in the hands and knees position, or on the floor in the hands and knees position, or back onto the birthing ball again, and get you mobilising. That'll get your labour to kick in again, and then when labour has started to progress again, then we would get you back into the water. We don't like you being in the water for much more than 5 hours because you can get overheated, the baby can get overheated, and the longer you're in the water, over 5 hours, it increases the risk of infection. But up to 5 hours, we've been shown through research that that's fine. So you'll sit in the bath and your partner's free to get into the water with you, but that's not a thing that a lot of men in Northern Ireland want to do, but some do, and they're very welcome to try that if they want to. But lots of men just will sit on the little ledge here, they'll dangle their legs into the water, and then you can lean up against this little part of the bath here and lean back against that and relax. At the same time, your partner then can be giving you a little bit of shoulder massage, or if you're on your hands and knees and leaning over this way, a little bit of back massage. So we find that the water is very good for a few things. It allows you to be buoyant, it gives you pain relief, it allows you to relax, and also the main reason that women like the water so much is because they have a very gentle birth. When the baby is being born, it's born from a watery environment within the uterus into a watery environment in the bath, and therefore it doesn't really realise a change in atmosphere very quickly. So you find that it's a very gentle birth. The babies come out, they don't cry very much, and sometimes it actually takes them a minute or two to realise they've been born, but they're very active, very aware, they're looking around them because they haven't had a lot of pain relief. And then we find that the great benefit from that afterwards is that they're very quick to feed, and especially if you want to breastfeed, which we do encourage in home from home as well, they latch onto the breast very quickly because they're not sleepy because of other drugs that you might have had otherwise. In home from home, as well as using pethidine for pain relief, if that's what you choose to have, we also have EnterKnox. We have EnterKnox in 3 parts of the room so that you can move about. It can be attached into this little plug here. It's also attached into this little plug here, but most importantly as well, it's attached above the bath. So you find that people who are worried about using the water think they can't have anything else while they're in the water, but indeed they can, because the EnterKnox is piped in and they're able to suck on the gas and air at the same time as use the relaxation from the water.
I hope you find this information helpful. We have tried to cover everything from self-help right through to epidurals. The DVD will be backed up with a question and answer period during the antenatal parentcraft classes. In the meantime, if you have any questions, please feel free to contact the Parentcraft office on 90 564 836.